Hello and welcome. I'm Steve Clemons, editor-at-large of The Hill. Thanks so much for joining us for the second session of our timely and important discussion on the future of healthcare, tackling costs and pathways to care. I'd like to thank our sponsor, Viatris, for its support of today's conversations. In this hour, we're going to hear from a former member of the White House COVID response team, health economists, patient advocates, members of Congress, and more. Before we get underway, a quick reminder, you can tweet us at The Hill Events, but more importantly, the hashtag The Hill Health. We're broadcasting live and we'll take your questions throughout the program. As with any live stream, you could experience some trouble. Just push refresh the page and all will be well. My first guest of this session is Andy Slavitt, former senior advisor to the Biden administration's COVID response team. He's also author of a new, really important and fascinating book called Preventable, the inside story of how leadership failures, politics, and selfishness doomed the U.S. coronavirus response. Wow, it is an indictment. I'm really looking forward to talking with you, Andy. Thank you so much for joining us. First, why don't you give us a snapshot as you see it of Preventable, why you did it. There's been an enormous response, but tell us about it. You're muted, Andy.
Oh, sure. Just the mute button. Well, look, the last year and a half has been unlike anything most of us have ever experienced, certainly in our generation. I think it's important to look at what we could have done better. And I think that's probably true on a few levels. A technical level is sort of the most obvious thing people talk about. What could we have done better at the CDC? But I think we also have to look beyond that. We have to look at two more pictures. One is at the political leadership level, and the other is at the level of what did we as a society do and how well did we do in preventing deaths so that we can get it better next time. And I think there's a lot of interesting things that you've learned in the book, both about where the U.S. now in terms of how it views science, about how different people live their lives, and then a bit of the inside story about what was going on inside the White House, what the Trump administration was trying to optimize for, and how that all played out politically. So a lot of lessons still to be absorbed, an early read on history, and of course we're still in the middle of it.
Well, look, one of the reasons I'm so pleased that you did this book, and I hate to be so stark, but you're a stark guy as well and very blunt, is we go through something like this and we've got more than 700,000 Americans dead, millions around the world. And, you know, I just watched Alex Gibney's show the other day that kind of lays out the sequence of decisions and what happened. And it kind of makes you sick in a way. And so, you know, I think we're storytellers. And if you're a storyteller, there are sometimes villains, sometimes there are heroes. There are lots of shades of gray. But if the villains aren't held up, and if you don't know who the villains in the story are, then it's very hard to figure out how to do it. So tell us about who some of the villains or what some of the villains were in Preventable.
Well, let me start with who, in my opinion, is not a villain. Everybody around the country who did their very best with whatever information they had to make difficult decisions to balance getting the economy back with saving the most lives. And there are 50 different governors with 50 different approaches. And I'd say 46, 47, 48 of them, even though they took different approaches, were really doing their best. So I think we ought to not penalize people for things that I would call honest errors, honest mistakes. There are also, though, dishonest mistakes, things that are not were not done in our best interest. So when President Trump, for example, found out in January of last year that this was going to be a deadly pandemic virus and refused to tell the public about it. In fact, he went to bed every night for 2 months, presumably slept soundly, until the NBA season was canceled, when he was forced, and the stock market was down, when he was forced to come forward and say, you know, yes, there's a pandemic. You think about what was lost in those 2 months, how American families could have protected themselves and responded if the president had done his job. So to me, that's in the category of a hard to forgive mistake because it was willful. Suppressing science and scientists, also very difficult. And playing politics with a public health crisis. You know, those are things that probably we should look at a little more skeptically. Now, when I say villainously, you know, maybe that's not the language I would use, but I would say that these are the kinds of things, and we've seen them, that are just where we don't have the common interests of the American public at heart. And I think we should be very concerned about having those kinds of political decisions made on our behalf.
So I guess the big question, Andy, is one where how vulnerable are we to this sort of I don't know what they call it, Keystone Cops, hijacking. I mean, just to hear the hydroxychloroquine story and how that unfolded. And I see Peter Navarro is still out basically talking about, why he was right. And you find the fact that we almost came within an eyelash of having a generic drug that is needed for lupus patients and other things taken away from them and used and flooded in other ways across the street to deal with this is just a remarkable thing in the United States of America. And so it raises the obvious question of whether it's about our democracy, whether it's about our healthcare system, how fragile do you think we are? And so when you talk about the future and what needs to be shored up, I just am really interested because I do worry about the second coming, not the second pandemic, but the second hijacking of the system, or the wobbliness of trust in science, if you will.
Look, I think where our weak spots are is it's very easy to spread misinformation in this country, and we've got a very willing audience for it. We have people who are, for whatever reason, skeptical of government and susceptible to conspiracy theory and skeptical of expertise. Now, I think the experts and the government ought to take some responsibility for that and say we're partly to blame, we need to do a better job, et cetera. But that's not the whole picture. The whole picture is that somebody on Facebook could literally say virtually anything, and if they hit the algorithms right, they can get tens of thousands or even millions of people to believe them. That is a very susceptible place we are. Now, we have 75, 76 or more % of adults vaccinated. And in most things in life, 75, 76% is enough to win. In this pandemic, in the case of Delta, it's just not. So the disunity we have, the large number of people who are holdouts, not just to not get vaccinated, but to say that that anything they're hearing from science and scientists isn't to be trusted, is a real cost. And I think we've got to go much deeper than the 2016 election or much deeper than the pandemic to get to the bottom of it. I think it's something that is more deep-seated and perhaps has always been ingrained in this society, but has become, over the last 2 or 3 decades, a really powerful part of our society. And that's something that if we do face this again, as you suggest, people, anybody can exploit that, whether it's a Russian disinformationist or whether it's people in our own country who just like to do it for fun.
Let me ask you another question about exploiting or overcoming the divides in society. So I guess one of the things that I learned from COVID and drilled into was, I was not as aware as I should have been of the disproportionate outcomes in health across racial lines, socioeconomic lines, but I am now really very much aware of that. And COVID, helped highlight something that you just see across sector and sector and sector in the healthcare arena. And so I'm wondering if there are any things that you and the Biden team were able to do that give promise in terms of how you were reaching communities of color to the degree you think you did and help build trust and get them under the tent of vaccinations, et cetera. But are there things that you did that can be replicated, in other parts of the healthcare arena?
Well, look, it's a great question, and I'll give you an example of how one might approach this. It was early on. It was clear that as we had a limited supply of vaccines, those vaccines, as they went out, were getting scooped up by people who had modes of transportation, access to the internet, lived in the suburbs. And we had this sort of vaccine tourism where, white, well-off people would come into black neighborhoods and other neighborhoods of color, and they would get in line and take the vaccines in those communities. And, the first day we opened up a national vaccine site in Oakland, it was packed with people from where? San Francisco. So what we learned is that you have to make an extra effort. You have to actually do this with some focus and some purpose. And so, from then we basically said a certain number of hours need to be reserved for people living in the community, and that made a big difference. We had to talk with people to where they were, because remember, there's, some of us who get paid a salary have a little bit more time on our hands, have transportation, et cetera. But if you're working by the hour, you're cleaning hotel rooms, you're not getting time off. You have to take the bus perhaps to a vaccine site. You're just not going to get yours. And so, if you really want to solve these problems, you can't treat everybody the same and just put a bunch of vaccines out there and hope they get to people. You have to get to people where they are, in their workplace, in church, and reserve hours for people, provide free transportation. We did all of those things, and we caught up. And we nearly eliminated the disparity in vaccines. Now, there are people that would say, well, that's not fair. Why are you making extra effort for some people as opposed to others? But you have to overcome the structural issues. And the structural issues are that there's not medical care available in the community to many populations, Black and brown, rural, low income. And if you don't address it, then those people get left behind.
Well, listen, I really appreciate your candor as always, and I want folks to pick up your book. But I also believe it was either your birthday today or yesterday, so happy birthday. But Andy Slavitt, former senior White House advisor and author of Preventable: The Inside Story of How Leadership Failures, Politics, and Selfishness Doomed the U.S. Coronavirus Response. This has been great. Thank you so much for joining us.
Thanks for having me.